Hello and welcome. Today, the most important topic. Sorry for the delay. We have started late today. There is an election here in Kolkata, municipal election. So, 153, aphorism number 153. We have stopped in the last class at 152, telling that from 153 onward, one of the most important topic will be start. So, better to take it in the next class. So, 153 aphorism number. As you all of you know that it is regarding PQRS, means peculiar, queer, rare, and striking symptom. PQRS, most commonly known. So here uh, in this search for a homeopathic specific remedy, what is a specific remedy? We have dealt it. That is to say, in this comparison of the collective symptom of the natural disease, underline this, in this search of a homeopathic specific remedy, that is to say, underline this line, collective symptoms of natural disease, underline this. You have a, after case taking, you have a set of symptoms from the natural disease. After drug proving, you have a set of symptoms from the drug, and you are trying to match it in this way. You are trying to match it in this way with this list of the, with a list of the symptoms of the known medicine. Okay. In order to find among these an artificial morbific agent corresponding by similarity to the disease to be cured. Okay. Underline from here. The more striking, singular, uncommon, and peculiar, in bracket, characteristics, signs, and symptoms, in bracket, characteristics, signs, and symptoms, underline this. This line is famously known as PQRS, but where is the Q here? No Q, but in translation Q is missing. Actually it is queer, QAR, striking, striking. Okay, in some older translation there was a word, instead of striking there was a word queer. Queer means remarkable. Okay, from that this PQRS is coming. Peculiar, queer, rare. This singular is rare. Okay, striking, PQRS, peculiar, queer, singular, rare. This uncommon, rare. This uncommon. Okay. Signs and symptoms of the case of disease are chiefly and most solely to be kept in view. Underline this. Chiefly and most solely to be kept in view. Okay. This PQRS is so important that this should be kept in view. Okay. Not that you are going to prescribe on this symptom. You got that particular peculiar symptom and you are going to prescribe on that. It is not. It is to be kept in view as a guidance. You will see that if your medicine is matching with this peculiar characteristic symptoms, then other symptoms will fall in line. Okay. So later on it was developed as a concomitant. Concomitant we have discussed there in aphorism number 95. In aphorism, what is aphorism number 95 is dealing with? It is dealing with the lesser accessory symptoms. Okay, for whom these less accessory symptoms are lesser? For the patients, not for the physicians. Okay, so this was when we were dealing with that lesser accessory symptoms. I have told you that this is nothing but a flat totality. Okay, a flat totality. Give me some time. This blackboard is there, so I need to use a white pen. or red pen. Okay. What is happening in acute cases? What is happening in acute cases? The things are very clear and it is striking to your mind. Symptoms are very violent and striking to your mind. But in chronic cases, symptom, a flat symptom, patient have forgotten about it. Okay, but this is very peculiar because it is running through the case. That particular symptom is running out through the case. Whole history, in the whole history, suppose patient is suffering 10 years and this symptom is there, but it is now not that sharp as what in acute case. It is flat. Okay, it is not sharp, it is flat, but you should take notice of it because it is important and characteristics of the symptom. Suppose a patient is having a particular symptom, or with all other symptom, a patient is having a particular symptom. Whenever doctor, whenever I am going to toilet, there is a lacrimation from my eyes, and this is quite normal for me. But you know, this is not a normal symptom. You look into the repertory and got some remedy, and thuja was most prominent. And what you do, you did uh, a re examining of case and thinking that thuja is when symptoms are falling in line for the thuja. Okay, doctor, I am, whenever I laugh, there is tears in my eyes, there is lacrimation. Whenever I yawn forcefully, there is lacrimation. Okay, this is a peculiar symptom. Lesser to whom? Lesser to patient. That's not a big deal. I'm not consulting you for this. Okay, but this is one of the symptom. Either you have noticed by chance or patient have accidentally told you, but you have to take it into the consideration because this is striking, this is peculiar, this is uncommon. Okay, so these characteristic symptoms may be lesser to patient. Number one. Okay, characteristics, try to understand what I'm trying to tell. This characteristic symptom PQRS may be lesser to the patient, but it is important to the physician. Number two, this characteristic symptom may be important to a patient and important to the physician as well. Okay, so you have to you have to keep in mind these characteristics symptoms. Characteristics include all. What is striking to your eyes? What is striking to your eyes? There is a constant blinking of one eye while the patient is talking. This is a freeze zone for you. There is extraordinarily red lips. This is a freeze zone for you. You cannot striking. You cannot keep your eye from that. You have to keep in mind that particular symptoms either you have noticed or patient have told you, or by accident patient is telling, but it is not important to the patient. I hope you are getting what I'm saying. So this is we call freeze zone, from where you cannot deviate your eye. You have to keep in mind that symptom. Okay, this is characteristics. So characteristics can be, number one, lesser to the patient, important to the physician, important to the physician, important to the patient as well. So number 95, lesser accessory symptoms are already falling in the group of characteristics. So see here also, there in bracket characteristics is mentioned. In bracket characteristics is mentioned. Lesser accessory symptoms which are often very pregnant with meaning. In bracket characteristics. Okay, got it? Good. Now, so this was regarding chiefly keeping in mind. Now come with me to aphorism number 211, 200 and 213, I think. Wait a minute. Uh, 213. Okay. 213. Aphorism number 213. Okay. Chiefly to be kept in mind. Okay, 211, sorry. 211. This holds good to such an extent that the state of disposition of the patient often, chiefly, determine the selection of the homeopathic remedy. Okay. Often, 211, underline this, state of the disposition of the patient chiefly determine the selection of homeopathic remedy. This state of disposition, this mental attitude of the patient is one of the characteristics. So characteristics is so vast a term. You are finding in mental sphere, you can find it in physical sphere. Okay, you can find it in patient's lesser accessory phenomena. Now come with me to aphorism number 235. Third last line. Third line. But the symptoms of the patient during the interval when he is free from fever must be the chief guide to the most appropriate homeopathic remedy. Underline this. 235. Third line. Symptoms of the patient's health during the interval when he is free from fever must be the chief guide. This is regarding intermittent fever. So the symptoms of the patient during the paroxysms are important, maybe characteristics, but the chief guide should be wherever Hahnemann is telling about chief guide, he is telling about characteristics. Okay, so characteristics you are getting in intermittent cases, you are getting these characteristics in the this state, in the state where the patient is free from any fever. Okay, during the interval when he is free from the fever must be the chief guide. So it is also falling under this characteristics. Okay, so come to our main topic 153. The most striking, PQRS, peculiar, queer, rare and singular, uncommon and singular, signs and symptoms. Okay, there you will get a footnote regarding Bonninghausen. Hahnemann have praised Bonninghausen at two places in this. Okay, we will discuss that later on when we will take some of the methodology of Bonninghausen, BTPB. We will discuss to some extent of that methodology. Bonninghausen, now read the footnote. Bonninghausen, who has already distinguished himself by his labors in the connection with the new system of medicine, has lately increased our obligation to him by the publication of his important little book setting forth the characteristic symptoms, particularly of antisoric medicine, entitled, this is mentioned regarding repertory of antisoric. Okay, at the end of the second edition of his this. Now footnote 2, sixth edition, Dr. von Bonninghausen and Jarver added. Hahnemann have praised them because of their their repertorization, their characteristics, repertory. Jar and Boning Hussain, Haniman, Jar was a student of Boning Hussain, was also a student, but Jar was junior to Boning Hussain, and Jar was a more interested student before Boning Hussain. Hahnemann have given him a task of compiling a repertory of a symptom. Hahnemann was also using his own repertory which he have made, but Jhar were interested by Hahnemann to publish a repertory of all the homeopathic medicine available then, but Hahnemann was not happy initially with his work. Okay, later on he praised Jhar in the 6th edition finally. Leave that. But in chapter of intermittent also, in the section of intermittent fever also, there is a repertory by Boning Hussain regarding intermittent fever. So Hahnemann have praised that also. What these repertories are actually doing are helping to find out the remedy for a particular, for a peculiar symptoms. You will get easily, you will get medicines easily for that. What repertory is actually helping. Okay, so repertory is during Hahnemann's time was totally based on Materia Medica Pura. Okay, so these repertories are most reliable. This BTPB. Okay, but people who know how to use BTPB are gradually declining, means declining in number. People are not really using this BTPB, Boning Hussain's therapeutic pocketbook, because now the art of using that repertory, that BTPB is totally based on those provings, Materia Medica Pura. Okay, those initial drugs, very helpful. BTPB, what the title of BTPB is to find out the remedy. If you go to the title page of the BTPB, you will see that an aid to read Materia Medica Pura also is added there. So from here you can read Materia Medica Pura as well. With the, it will help you with the repertorization of your case also. It is very important repertory. Maybe in some future classes we can take this BTPB, Boningson's therapeutic pocketbook, and its importance and its clinical use. In my clinic, I am just using the last chapter of last section. Mostly I'm using the last section of Boningson's therapeutic pocketbook, which is the relationship chapter. It is most interesting chapter, and most often I am getting help by this. But nowadays, more importantly, previously I was using that last section, but nowadays I am using this encyclopedia of the remedy, relationship in homeopathy by Abdur Rahman. It is easier to use than that. So much relationships are there, and for easy reference you can use the table, reference table given by Gibson Miller, attached with the Borix Materia Medica as well as Kent's Materia Medica. So relationship of the remedy is important. I'm using nowadays this encyclopedia of remedy, a relationship by Abdur Rahman. You can get it a PDF copy in the on internet, or if I have, I will send it in the group and have a Xerox copy of it, because it is very costly. International publication, it may cost you too much. So as a student, this was this I got during my PG days, and I'm using it. So as a student, you can take the help of that PDF. Now, so बात कहाँ से कहाँ चली गई? 153 Boning Hussain's BTPB, Boning Hussain's therapeutic pocketbook, is one of the important book which Hahnemann himself praised laterly. So it but the user of this book, or how to use this book, people are very declining in number. Here we have learned this art from our teachers who were teaching in National Institute of Homeopathy at that time. They have taught us this BTPB in detail. Now, next, of the case of disease are chiefly and mostly to be kept in view. Underline this. More particular these that very similar ones in the list of the symptom of the selected medicine must correspond to, okay, in order to constitute it most suitable for the effecting the cure. The sentence ends here. Now the next sentence, whole 1 2 3 4 5 6 line sentence is there, 5 line sentence is there, a single sentence. The more general and undefined symptoms, underline this. There is a difference between Hahnemannian general and Kenshian general. Do you know that? Hahnemannian general and Kenshian general. Kenshian general is talking about man as a whole, and it is highest grade in the evaluation of symptom. But Hahnemannian general is undefined symptoms. Okay, is undefined symptom. The more general and undefined symptoms like loss of appetite, headache, debility, restless, sleep, discomfort, and so forth demand but little attention. When that the vague indefinite character, when there is a vague character, it is present in all of the disease. Mostly, most of the disease, these symptoms are present. Fever hua hai, loss of appetite is there. Okay, restlessness may be there, sleeplessness may be there, headache may be there. These are undefined. Patient is telling you, Dr. Babu, amar headache hoyeche, just headache. This is undefined. But if this headache is defined by characteristics, that is what Boning Hussain have done. Break up the symptoms in location, sensation, modalities. Okay, so if this headache is defined, doctor, this is occipital headache. This is occipital headache ameliorated by profuse urination. You can think of gelsemium. Okay, this particular combination is also making it characteristics. Particular combination of sensation, particular combination of location, particular combination of modalities will also make it characteristics. But if it is more general and undefined, sleeplessness और कुछ है ही नहीं, but sleeplessness after midnight, sleeplessness after thinking due to constant thinking, sleeplessness at night but sleepiness in day. These are the defined symptoms. Okay, so demand but little attention. These symptoms demand but little attention when of that vague and indefinite character. If they cannot be more accurately described as symptoms such as general nature are observed in almost every disease, underline this, almost every drug, underline this. These symptoms, if undefined by sensation, by location, by modalities, it is present in almost every drug, almost every disease. Okay, so underline general and undefined symptoms, underline every disease and every drug, underline that. Okay, from here we are entering in the topic of discussion for the keynote. Okay, keynote prescribing. Often the Calcutta School of Homeopathy has been accused of these keynote prescribing. Okay, you people are saying that you people are doing nothing but prescribing on the characteristic symptoms, and you are biased with these keynotes. Okay, like Allen's keynote, there you will find many lines with bold letter. Okay, with bold, like most famous example I used to give is Brainia. Okay, Brainia, you will find the modality of Brainia. The modality of Brainia is aggravation by any sort of motion, aggravation by motion and exertion. This motion and exertion, this motion, aggravation by motion, one of the chief characteristics of Brainia is aggravation from any motion and corresponding relief from absolute rest, either mental or physical.